Hi guys, it's me again. I'm a month out of surgery for I don't even know what it's called. They removed my butthole, guys, parts of my colon, or my whole colon actually. And I have a stoma, little bag, little pooper bag right there. I don't know if you guys could even see, but it's a little bag. Anyway, for those of you just checking in, hi. I'm doing much better. I think you could tell in my skin color and my eyes might seem a little bit more alive. I'm fully off of the pain pills. I was taking some just once in a while because of doctor's appointments, going to and from the Bay Area, having those 2-hour drives with the bumpy, great California roads. And yeah, 2 hours there, all the appointments, and then either coming home right after or staying the night and then coming home the next morning. It wiped me out, like physically and emotionally. Like it just takes you out. So I was taking like some pain pills here and there for that, and then like a day after, just so I could sleep and get the rest that I needed. I did recently have a CT scan last Friday with contrast. So, with contrast, that means I drank this drink that was super yummy. So yummy. And they said it tasted like bananas. Talk about ruining bananas for you. Jesus. And then, they did an IV and they shoot this stuff in you and it gets your body all warm, makes you feel like you peed your pants. It's quite an experience. I would say everybody should have one once. Anything more than that, you feel like a freak leaving the hospital and like you're glowing or something. It's really disgusting how you feel after it. Unless that's just me, and it could very well just be me. But anywho, yeah, so I just got the call today to schedule because in that CT scan they did see a buildup of fluid around my surgical site. So they want to put a drain back in me, which I am so excited for. I probably am not going to call the hospital back until Wednesday because I have to wrap my mind around the fact that first I have to get a drain put back in when I already had a drain in, which that just makes me crazy. Two, that they're not going to put me to sleep. And three, that they're not going to put me to sleep. And I'm going to have to personally walk into an office knowing that and say, yes, can't wait. Go ahead, cut me open and put a drain back in me. So I got to mentally wrap my head around that one. So that's going to take me like a day at least, maybe two. I don't know. I am taking I sound awful today. I'm just like an asshole. Sorry. I've I've had a really bad mindset lately and I'm trying to work it out, and I think by working it out, I have really dry humor or really bad humor. I don't know what's happening with me, but this is my way of talking myself into doing the shit that I don't want to do by making fun of it. So please just bear with me, you guys. I am on a high dose antibiotic, hoping. I don't know if this was my doctor's way of entertaining me, but I did beg him for it because I'm like, well, it's probably just like some really bad infection and it'll go away if I take antibiotics. So he said it takes a week on the antibiotics and then it should take another week for the antibiotics to like fully get their effect. So I also am waiting on calling the hospital to do the drain because I'm hoping the antibiotics just kill it all and it goes away. I really just don't want to be poked anymore, truthfully. I still gotta go get a damn port put back in. And that I'm okay with because they knock me out. That to me, I'm a mom of four. I have 2 businesses. That's like a nap, like a drug induced nap. And not that I'm into that kind of stuff, but I mean, after you take drug induced naps like once every 3 months, you kind of look forward to it because that means you sleep really good and no one wakes me up. So I don't know. I'm kind of looking forward to it, but not. What else did I have to tell you guys? Okay, so I'm on antibiotics, had the CT scan, no cancer spread. There was actually no cancer seen. I did take a blood test. Oh, I wanted to tell you guys about that. This is upside down. This is Natera by Signatera. And this, everybody, I really wish this was offered to everybody. I really don't know what your guidelines need to be to get this, but this is a blood collection kit. They send somebody to your home. They send you the kit in the mail. I got mine FedEx this morning. Guy tried weaseling out because I had dogs, so I had to go fast walk. Fast walk. I don't fast walk. I'm barely even walking. I mean, I'm walking, but it's kind of a sad show. So anyway, but I had to yell at him. I'm like, where are you going? Do you have a package? And he's like, yeah. So I'm like, can I please get my package? Because it was this. I already got called for the appointment. I'm like, I haven't gotten a package yet. Well, it's because the goddamn FedEx guy's a chicken. I'm like, just leave it outside my gate. Freaking guy. Anyway, but this is Oncology Health, Oregon Health. It is a tumor detection kit. So it will detect the most minuscule amount of cancer in you. So my surgeon went in, cut out the cancer in that big surgery where I ended up with a Barbie butt. And he cut out most of my butt functioning things. I don't know what any of that stuff's called. I really need to educate myself. But anyway, he cut it all out and he thought, he was scraping my pelvic bone. He did like as extensive as he could without physically harming my body or harming me for, future. And so these are kits that will trace like whatever's left in there. So I already did one last month. You're to do it every month. I have to do a blood draw. I wish the hospital and this company would kind of maybe communicate because I just had a shit ton of blood done for another test. But anyway, whatever. They come to your house. It's super simple. I mean, I literally could be in my PJs and get it done. But yeah, the kit is supposed to be new technology. My new surgeon, he was like, hey, this is like the new stuff. This is the bee's knees, So had it done last month. I don't even know if I got my test results back from it. Either way, if my test results negative or positive, saying I do have traces, I still have to do my chemo or not my chemo, but the chemo and immunotherapy just to verify that this cancer does not stay. The surgeon, like I said, he did do an extensive removal of my body and tissues and stuff, but there's going to be fragments left in just because that's just how surgery works. So this is just a protocol just to verify like, hey, you do have some fragments. Now, next month, I'll do another blood test, and throughout chemo, it'll say, hey, you've got no fragments shown, and then even after chemo's done and over with, I'll continue to monitor this. I don't know if I'll do it monthly or what, but it will continue to monitor and let them know, like, hey, there's traces there. I am so tired. I just woke up from a nap. I think I woke up early. My kiddos are loud. But anyway, yeah, so anywho, that's my update. I think I have an appointment coming up like the 23rd or the 28th with the oncologist over the phone because he wanted to start chemo right away. And I was like, you cannot for one, you can't give me another surgery right now. Like, I am not going under the knife right now to get a port put in. Like, I am struggling to heal from this last surgery, and now I know why, because I've got freaking fluid building up. But, and then I don't think my body's strong enough for chemo right now. Like, I was super malnutrient when I had my last surgery. I honestly, it was horrible, but I really didn't know how well that was going to go. I didn't know if my body would handle that or not, but I was hoping for the best, and obviously it worked out. So, mind over matter. But anywho, yeah, so I got that coming up. We're going to discuss whether or not, like, I feel like I'm ready physically for chemo or not. And then we'll go from there. I'm hoping each week I get so much stronger. I've been trying to set my timer and walk 15 minutes, or like this morning I got up and put the dishes in the dishwasher and hand washed a few dishes and made some croissants for my daughter and ate breakfast. And then I was just wiped out, and then ended up trying to lay down, and that didn't work. So I was like, well, maybe I need to walk some more. So my husband and I walked around our deck. But yeah, I'm still doing like a nap a day. I'm just trying to gain strength, and I'm trying to eat. That's a hard one for me right now, because it's like 2 bites in, I'm just sickly full. And then anything more than that, I just feel sick to my stomach. Like I want to just throw up. So working on eating more, getting as much calories as possible when I do eat. So that way my body has the energy to keep going. So anyways, love you guys. If you have any questions or anything, just message me. I'm here. So any good series on TV I should be watching, or docu-series, or books I should be reading? Actually, don't tell me any books to read. My eyesight's like not amazing right now, and it probably won't get any better with chemo. So maybe books we'll have to skip on for right now, but maybe podcasts or something like that. I definitely am interested in some ideas to kind of keep me busy while I heal. So talk to you guys soon. Love you guys.